Hi guys, welcome back to the channel. Welcome back to Unique World. I am Abhinav Sandula, back with another episode of GMCM Talks. We are not in the college, we are in the Department of Nuclear Medicine here with Dr. Emmanuel sir. Hi sir, how are you feeling?
Hello Abhinav, I'm doing good man. How are you?
I'm just done with my final exams and reaching out to all the seniors and collecting stories and sharing them with juniors. So sir, let's start off sir.
Yeah.
We'll give an introduction because we are from juniors from 24 batch are also watching.
Okay.
Emmanuel sir is from 2K17 batch, so that's like 7 batches we had. He was our super senior
Super.
when we joined college. That's right.
Yeah, that's right.
So we had a really good bond in the college and we're trying to continue it even now, and sir is currently pursuing his nuclear medicine. But let us go back and start from college. Sir, you're from Hyderabad, right?
Yeah.
How was the experience of joining GMC mahabubnagar, the good parts about the college which you felt?
First thing is actually I wanted to explore out of Hyderabad.
Okay.
I've never been to an hostel.
Okay.
Till intermediate I was always a day scholar. So I always wanted to have that experience wherein I go to a different place, stay in an hostel, do all the fun part, because till intermediate and all it's only crazy studies. Till 10th obviously also it's still studies majorly. So I always wanted to do that. So fortunately mahabubnagar was the place, and it turned out to be much more greater than what I had expected.
Okay.
It was great, and we had lots of fun, especially everyone does cherish those, especially what do you call, hostelers can relate to it, where there's a lot of fun when you stay at hostel.
Yes sir. So hostel life, and talking to you, you were the second batch in the college.
Yes.
So the conversation is going to be very different because you have seen things which we have not seen, and the juniors, they don't even know about all that. And through this platform, we want to share their stories. How was the college when you entered? The struggles that you faced?
When we entered, actually, we had just a small block. Mainly it was, for the first 1 month, actually, we were not allotted any accommodation. So most of our boys, girls, they used to stay outside. They had, joined into all this, paying PG type hostels, taken up rooms and all. So the first month was struggle. And I didn't join into any of these outside hostels. I was traveling daily from Hyderabad.
Daily from
Hyderabad I used to come, again board the bus, get back. So that I think it went on till 30-40 days. Then finally we were allotted hostels and all. Then it was just 2 batches back then, 2K16, the senior most batch, and us.
17.
So it was just the same hostel. Actually, that is all currently the OBG and the pediatrics department where we used to reside. So there was a block for girls, there was a block for boys as well. It was good, a small place, a compact place, but great interaction.
Packed with fun.
Packed with lot of intensity.
The kind of interactions you had, it's not happening currently. Times have changed. This is the way we are interacting with juniors now.
Social media
is the way of interaction. But it was very adventurous for you, I think, being a 19-year-old, 18-year-old in mahabubnagar.
In mahabubnagar, when you're, first time you're out of home, there's a lot of freedom. You can do anything literally, and we did a lot of things.
You did a lot of
which obviously,
Didn't sleep at 10 p.m.
Never. I think, I'll tell you, to be honest, I think most of the first year, if I'm not wrong, I've never slept before 3 a.m. Never.
3 a.m.
3 a.m. Okay. 3 a.m. 4 a.m. was the basic routine. You get interactions with your, your seniors. Then we used to, there was a small corridor just in front of my room where me and my friends all, Ajay, Shabino, Rizwan, Badri, Akash, we all used to play cricket. I used to not allow anyone to sleep. Okay, there's a small corridor. We used to keep playing cricket till 2:30, 3:30 a.m.
Okay.
And finally, then once we are done, then we used to go and at that time PUBG arrived. Then we used to sit, play PUBG, and once we are totally exhausted, then we used to go sleep. And the crazy part being, I used to wake up again at 12:30, 1 p.m. And I used to go to the washroom and keep brushing my teeth. I used to feel awkward when my batchmates used to return fully dressed in an apron and they are coming back to have lunch. And here I am in my shorts.
Just woke up.
Just woke up.
For brunch.
Yeah, for brunch. And what? After eating lunch, again I'm going back to sleep.
So the senior interactions, I'm asking you especially because now you're doing your post-graduation. And so you'll have a clear idea about how those senior interactions helped you, or damaged you, or how was it? How was that experience? Because that is the controversial topic around the entire country, seniors, juniors, ragging. So I want to lighten up that topic and ask a postgraduate student about how you feel about the undergraduate interactions and everything.
I think it is a necessity, like it has to happen. Obviously there are limits to it. I mean, in recent times we might have seen there are few instances where it has gone above the limit and it has harmed the student in a much more grievous way. I think that is not what is acceptable, but basic interaction should be there. For every small thing, if these juniors go and give complaint, I think the world doesn't function like that. And through interactions or through those initial 3-4 months is where you make good friends. There are so many of my seniors who have ragged me the most. Those are the people whom I'm still in touch with. Those are the people whom I can still text at any point of time.
We can use our interaction as an example. We've interacted and now we have a connection for life.
Exactly. Imagine, if that interaction where our gang didn't interact with you, I don't think we would have
this conversation. We couldn't have it today.
If if you were repelling against us, or if we were not the way we were, I think it would have never happened.
It is required for a healthy college life to continue. We have so many students from our college. If a student joins your college for post-graduation and if it's close to you, it will be a very
it is a learning experience, overall. Like even when the seniors tell you to dress up properly and all, I think all those are good things. Like someone tells you to shave properly, wear good clothes and all. There's nothing wrong with it. It's like we are, at the end of the day, we are doctors. Okay, so you have to maintain some kind of professionalism. So I think indirectly it's a certain way of teaching that thing. Obviously there are limits to it, but I think within limit it has to happen.
And taking things from you, sir, like we interact and the benefit, not the benefit, I am going to use this as an example. When you came first to our class, when we were 2020 batch, as a juniors, we were all sitting in the class, you came to address us. We looked up to each and every one of you, not mentioning a person or anything. Each senior, their story, their way of talking, their way of dressing up. We were like, okay, one day we are going to enter final year, we need to be in that position. So that, no, I am not going to call it hierarchy. It's just the order of things. Everything is going to fall into place, because when you are 18 years old and you enter college, you don't know much. So you had one senior batch, so lucky. Like if you didn't have any seniors, it would have
it would have been much more worse. I don't know how we would have been. But I feel lucky, but there's sometimes I feel that there should have been more batches. Because in certain aspects I felt that even like my seniors lacked few experiences. I think there's nothing wrong with it, because they had no one to tell them, like example could be PG preparation. Like in mahabubnagar, no one knew how to prepare for an exam, because no one guided us, to be honest, our seniors, and I don't even blame them, because who was there to guide them? No one was there to guide them. No one was there to guide us. So, it was kind of like figuring out how to do things. And there are few great people. I think the only person, the main person that comes into my mind is Saeed Arif sir, legend. I'll tell you, because of him, that was the first time I got to know that there's an exam called INISET for AIMS. I'm telling you, I was like, I NEET PG hoga. What more is that? But because of that person, and someone getting a 3-digit rank, that was like, okay, we can also do it. Someone does it, they get this small confidence within us. They get, okay, it is possible. So I think that was a big eye opener or game changer. And no one has so far even got close to that rank, but it's inspiring.
It's inspiring.
It is inspiring.
Instead of following any internet role models, picking inspiration from someone from
it's relatable. You see some random guy from AIMS Delhi doing shit, and he'll be like, okay, sir, AIMS Delhi wala hai. But when someone you have seen for 4-5 years does that kind of thing, then it totally changes.
You are that person. We want to take it from you. So how was your experience with our batch, 2020 batch?
Your batch.
Because
I think you guys, to be honest, and I'm not saying this because you are in front of me or
that's why I asked you specifically 20 batch.
I think I don't know if it's a generation gap. I'm not that old to call it generation gap, but you guys are something else. Because I've been seeing 16, 17, 18, 19, but 20 was something different. 20, I think most of you are extroverts, most of you are into so many things, like not just from studies, studies obviously plays a big role, but apart from that, you guys have so many hobbies. Like always, that sometimes when I used to look up to you guys, like, yaar, kya karna hai log, because there are so many, like you are one of the good content creators. I told you, right? I always had the ambition to do something like that, but whenever I see you, I'm like, okay, yaar, this is something I should have done, but I feel happy that someone else is doing. There are people in your class who are good at video editing. There are people in your class who have crazy leadership skills. You're doing social service.
Social service,
and I can keep
that is really
naming
inspiring.
stuff. There are good dancers, content creators. I'm like, yaar, kya chal raha hai?
We were able to connect so well.
Yeah.
Like even being 17 and 20, that is the
That's
example
good,
that I want to set to the juniors. Ki your immediate seniors or immediate juniors, it's not limited to that. College is not a bubble. You can explore.
Even I never thought that. Usually it's like because we were 17, maybe 16 is the closest or 18 is the closest. But I think not just me and you, but the entire 17 batch, most of them are very, very good friends with 20
batch.
And it happened so spontaneously. Like we never planned it, but that's how things go.
So it's a message for the junior to keep an open eye. You can always find a senior.
Always go for ragging first. Even if someone is not calling you, go.
Don't send this clip to anyone. So you were into sports and other activities back in college?
Sports, not too much into sports. I think I was not so good at anything, but always I used to drag myself and go. Like I was surrounded by crazy people, all my friends were really good, Ajay, Abhinav, all these people really good at what they play. So wherever they used to go, I was to drag myself. Even though I maybe never played a big part, but I was like I'll go. I was like, "Arey, ja rahe, hum bhi jayenge, bhai." But that's how it is.
So you had a complete experience in
I had a
MBBS.
complete experience. I had
The
a crazy
lows, the
experience.
highs.
Everything. Highs, okay. Lows. You guys were not even there when the lows started, okay. I think I can't even discuss my lows.
Not on YouTube.
People know it. Okay? People know it. My batchmates know it. But crazy lows. Highs. I think when I was in second year, I think it was a very, very crazy part. I mean, at a point I had everything. I was CR of my class and all, and suddenly things go bad, and everything is gone. Then things change.
Life experiences you have picked up so much.
It was a great learning curve, I'll tell you, because I think that has changed me as a person. There are many setbacks, there are many, you can call it humiliations and all, which you obviously face because, 5.5 years is a big journey. Everyone's journey is again unique. There's so many things you learn. I always, people might think, oh, what is there in mahabubnagar? It's a peripheral college, what is there and all, but I really miss that place now. And not just the place, for the people, for the friends I had, for the memories I made, and most importantly, as you asked, the experiences. I think it changed me as a person. If I had been in some other well-off institute, I had all the luxuries and all, maybe I would be a dumb fellow now. But those experiences is what make you a different person, because as you said, we enter around 18-19 years, and by the time you come out of the medical college, you are an adult, you'll be around 22, 23. So that phase, the transition happens just based on those experiences.
You've tried out everything.
Yeah, we have tried out everything.
You've gone for everything.
You've gone for everything.
You've learned a lot. So that is the way to do it, right, sir? In MBBS, like sitting in your room and just spending all day not doing anything.
I think, it's messed up these days, I think especially, I don't know, people are not interacting. And people are becoming too studious. I don't know.
No, sir. I'm going to not name anybody, but an example which I see in juniors is they sit, they study every day, which is very good.
Good.
5 to 6 hours, and rest of the time they spend on Instagram reels, and the day is gone.
The day is gone.
I mean, that is not the way to do college, right, sir?
That is not the way to do. Was like they hardly know what at least their roommate is going through. Like they don't even know what is happening next door. Was like, what is the purpose? Obviously, as you pointed out, good to study. Obviously, we are not discouraging anyone not to study. You have to study. But
when we were interacting with sir was asking us all questions, and he was reading surgery breast, I remember, on your iPad. I was thinking, oh, okay, this is how you multitask in medical college, right?
What a topic to read.
No, we took inspiration from you. Whenever we used to interact with juniors, we would also keep studying. Me and Shiva would study, and at the same time, so it's not like don't waste your time spending your time on phone, because you can do that anywhere, anytime, at any point of life.
There's enough time, there's enough time for everything.
But college time is very limited.
It is limited. They won't realize now. They'll be like, okay, what we'll do. But I'll tell you something. Once now, it's hardly been 2-3 weeks for me since I'm in my PG.
Post-graduation.
And things are way too different. It's not that friendly. It is a profession. You are a professional. Now, once you get the tag, you can't be the childish person. You can't play around, mess around, crack silly jokes, because everyone is serious, and you are in a serious environment. So if you want to do anything, MBBS is the time. After that, you are like, okay, I'll do something, I'll crack PG, I'll study, you know, I'll hustle daily 10 hours, and you know, after PG I'll do. There's nothing to do after PG. At that time, you know, you have again responsibilities. It's a professional environment.
This is coming from postgraduate. If I say that, it will be very wrong. But sir, we are not against anything, but we are encouraging you to explore your life, explore college. Mahabubnagar is a very fun place, right? So to explore, like if you take it positively.
It is like, you know, there's so many good places, you know, things have come up, there's so many, you know, places to eat now, you know, hardly those days we had only Himalaya, we had Prashant Himalaya and the old Zishan.
And not even proper roads.
And not even proper roads. You won't believe me, we used to go every weekend to Zishan, 10-12 of us in one auto. Okay.
Oh my.
10-12 of us in one auto, and we used to bargain with that fellow. We had to pay only 100 rupees, and we used to go, and while coming back, we used to walk and come back.
Memories.
Core memories. Now these days you have so many things, and anytime, boss. If you are bored, you know, it's hardly 2 hours. You can get to Hyderabad on weekends.
And that's like you need to have that fun part in your life. And fests and everything. So we shared one fest, I think.
Yeah, I think
even 18 batch organized the fest. We were interns.
We were interns. I think that was a good fun fest.
We had so much fun.
That was a well organized fest.
Thanks.
We had a great time. I still remember DJ night and all also.
Even the academic events.
Yeah, it was good. Yeah,
that's why I'm asking you. Like even in our college, you can pursue your academic interest even during events, not just our college events, even other college events, so we can participate. So balancing everything is the fun part.
It's the fun part. See, doors are open always. It's just up to you to explore. Like, you know, you guys were also, you know, you went to JIPMA for that thing, you know. I was so shocked, like, you know, I think you were third year when you went to JIPMA.
We just entered final year, sir.
Okay, final. Okay, you're just a third year pass out going to JIPMA. You're seeing some ECG thing and you won that thing or something, and you got that book ECG. I was like, bhai, kya kar raha hai tu? No, I'm telling you, because for us, like, when was the first time I read ECG was after my internship, when I was preparing for that. Then you read ECG and I was like, bhai, kya kar raha hai? And you know, there's so many things, not just you know, so many people, you guys are going, exploring.
That is the beauty of having seniors, sir. Like more batches above you. Because after Arif sir got his rank, he came back to us. We were feeling out of place for reading all this, going to like we were the people who read textbooks. I asked you also for textbook recommendations, right? Because now everybody is up to video researchers, lectures. We are not against it, but you or Arif sir come and tell us ki first go through the textbooks. Then if you are having any trouble, use the lectures. You can see the lectures whenever you want.
We're always there.
Reading the textbook, you won't get the time again. So small things like that we picked up from each senior, from each batch. And I think that is the beauty for somebody from 24 batch. There are such lot of cool and interesting people in 23, 22, 21, 20. It's all the way up to 16. So that is like a blessing in disguise, right? And now that is the message I'm trying to keep pushing from GMCM talks. So thanks to you.
Thanks to you as well.
All senior batches in general, that we are able to continue this, and hopefully our college is going to obviously explode because of the previous batches.
Because, you know, I feel the initial 5-6 batches, you know, the way they settle will set up the name. You know, now all this whatever college, you know, you call it Usmania, Gandhi. Why is it famous? It's not that, you know, something crazy is happening over there. It's just because those people, those who have come out of those colleges, they are at great positions. That is the thing, Funda. You know, now from 16 to 20, for example, or 2021, what they do in life, how they settle. Like, you know, if after 4-5 years, when, you know, Syed Arif settles, or, you know, other of my seniors settles, or, you know, when my own batchmates settle, and, you know, I ask them, where are you from? We say, okay, James and Mahabubnagar. That is when, you know, when I joined this department, so many people asking, where are you from? James, they're like, Mahabubnagar, okay. They're getting to know the place. And, you know, someone else turns up. It happens, you know, it is a gradual process.
Because people feel very disappointed as soon as they get the college in their first year. That's not how it works, right?
You have to set it up.
MBBS is the same everywhere, I feel like.
It is the same.
Because as you said, I've traveled everywhere and have felt that everyone is equal to us in all aspects.
It is equal. It's not that, you know, they are super, you know,
it is up to us how we are going to like decide
their resources, there's college, there's everything in place. It's just that how you turn up, and the initial batches, how they, you know, take out the name. You go outside, you don't speak bad about your own college. You have to keep it at top, and the way you settle in life after a decade will determine how big a name Mahabubnagar becomes. And I feel it is improving. There's good feedback, you know, after Usmania, Gandhi, Kagati. I think, you know, Siddipet is gaining a good name. Mahabubnagar also has a great name.
The thing is our hospital, sir. I love the hospital, and you also have very good things to say about internship and learning.
It is a good experience. Like, you know, as I told you, there are no PGs. Because of that, you know, there's a lot of work which you are doing. It might seem clerical work and all, but it is good. When you go and speak to someone else from a, you know, big institute and all, they realize that, you know, they'll be just making them learn for, you know, blood test reports, that this year also you'll be running, but there are many opportunities you get to learn the basic things. Because 4 years, what are you learning clinically? There's, you know, you're going to the postings and all, but that's still kind of theoretical.
2-3 hours.
Yeah, there's hardly 2-3 hours. You're just mugging up the books, you know, going for the exams. But that is the first time where you're, you know, hands-on. You are there somewhere, you know, you have to make own decisions. I still remember the first posting, okay, I think my internship, it started with medicine. They put us in ICU, me and Francis. We were the two guys in ICU. What do we know? Like, I think I had afternoon shift or something. We were in ICU and there's no one in ICU. They're like, can't manage. Boss, there are critical patients there, you know. There are people who are intubated, there are people who are about to die, and, you know, obviously you learn through that experience, but, you know, that is what you get. Like, you know, it's at this moment it might seem everything is, you know, nice, all sweet and all, but once you enter into the reality, I think that teaches you a lot. Internship also has to be utilized. There are many people who escape. There are many people who are like, oh, we'll study for PG and all. Obviously you have to study, you have to crack PG, but internship also plays a vital role.
What was your craziest experience in internship?
In internship, craziest experience. I think there are many experiences. Once I still remember, you know, in night time it used to happen generally, you know, we sit around in the casualty and all. What happens is, you know, sometimes we feel, arey, aaj kuch case nahi aa raha, there's no case coming. Someone tells us this dialogue, arey, today no cases coming, why is today's duty so cool? And you won't believe it, within half an hour, that casualty will end up turning the most hectic. Suddenly something will happen, some big, you know, RTA will happen, 2 lorries will collide, something, you know, 10 people will be brought off, and, you know, it's like a curse if someone sits in the casualty and they're like, you know,
commentators curse.
And there's also, I won't name anyone, but a few SRs and all. If they turn up on the duty, no, it is gone. Especially it was in OBG.
Okay.
There were few ma'ams. Everyone was scared. Arey bhai, aaj ye ma'am kaam karegi na. We are gone today. If this ma'am is on duty today, the most troublesome cases, everything will land up on that day. You might call it a coincidence, once or twice, but it kept on happening. We're like, we used to see the schedule and we used to make sure that if she is working on that day, I just postpone or prepone my duty. I'm like, bhai, isse kaam nahi karna. So crazy things happen.
We're going to experience it next.
We are going to experience it. It's going to be fun. It's going to be hectic, it's going to be fun. But
1 year of madness.
1 year of madness. And, you know, it passes by so quickly. People might be like, 1 year, what will you do? It passes by quickly. There'll be many hectic duties where you just come over, you eat and you sleep. And you get time. The good thing is you get also money, you know. First time, now you're earning some, you know, 25-30k bucks, and, you know, it's good. Suddenly you get money, you know, you can explore, have fun. But it's good.
Everything, sir, is just like passing really quickly in MBBS.
Yeah, see, boss, I hardly think just couple of years back, you guys were in first year when we came through, and now within a month you're going to be interns. I'm like, what is this? Imagine first year to internship within no time, and, you know, that's how time flies by.
That's why we have to like go for everything.
You have to go for it. Before you even realize, imagine, kitna jaldi ho gaya yaar.
Live like a movie. Live your MBBS life like a movie.
Just enjoy, have fun. Go around,
travel a lot.
Do what you want.
Do what you want. Comparison, sir, with the other person.
Comparison.
That is the main problem.
That is the main problem there. You know, I think everyone has their own struggle. You know, everyone has their own life. Nothing to compare. You know, they'll be like, even, you know, everything is so competitive. At least during PG, suddenly, you know, your own people become so competitive. They're like, "Arey, isko wo aa raha hai yaar." And what is there? You know, do whatever you want, enjoy life. Live life.
I also felt that the staff in our hospital was very, college also in general, non-clinical staff was also very friendly and
good.
It's not toxic like other colleges.
Toxic. You go and, you know, take experiences of other people, then you will realize what toxicity is. People in our college have not seen toxic people. There are obviously, during my internship, there are 1 or 2 people here and there in 1 or 2 people, you know, few departments which I don't want to name. That is will be there in every. But there's no department that the entire department is toxic. You know, they are going to torture you. They are not going to teach you. there'll be 1-2 psychotic people everywhere that you can ignore.
No, with other things also they are very supportive.
Yeah, they are
they
supportive.
encourage us and they are like happy for us.
Yeah, things are improving.
From Mahabubnagar, these students are able to do this blood donations, organization camps, awareness camps, and staff is also supporting it.
Yeah, there are many social service aspects that they're doing.
Yes, sir. So that is also something I happy about. Now, sir, currently, if you want to name where you are working right now.
Yeah, so
I don't want to mess up the name.
So currently this institute is called Basavatarakam Indo-American, Cancer Hospital and Research Institute. This is one of the premium and affordable cancer institutes, one of the best in South India. In North, obviously, you have the big, Delhi, and there's Rajiv Gandhi Institute and all big names. In West also you have, the Maharashtra Tata Memorial and all. But for South India, this is the hub. And I picked up nuclear medicine here. And this is a 3-year course for those who don't know.
Small introduction about nuclear medicine because we are completely illiterate about this topic.
Yeah, so this is a new branch. It has been in existence, I think, since 4-5 decades, but it has not come into the limelight because this is a very, it requires a lot of cost for that setup. It's a huge branch. So even in my department, I think the entire cost setup would easily cost around 50-60 CR if I'm not wrong. CR.
Okay.
So it's not something that all the places can afford, and it's a branch which you can kind of draw parallels to radiology. It's more of a diagnostic branch where we'll be diagnosing mainly oncology cases to 60-70%, and there's also other cases as well. And this therapeutic part as well, mainly we'll be dealing with prostate cancers, neuroendocrine tumors, thyroid cancers, where we'll be giving therapies to them. So the idea, if I had to split the ratio, it would be around 60-70% we are diagnostic branch, and there's also 20-30% where there's therapeutic branch where you work as a clinician. People might mistake it as like only a radiology thing, but there's also clinical aspects associated with it. That's why I wanted to ask
you about the patient interaction.
Yeah, it is the therapeutic part. There's a lot of patient interaction where again you have to do the basics, where you take a good case history and you decide the dosage of radioactive substance to give them and all. So there's a therapeutic part, and diagnostic part mainly deals with PET-CT scanning, where we detect where there's a major chunk of cancer cells in the body.
As an undergraduate, the thing which we know about nuclear medicine, I won't say nuclear medicine, we just hear about the last line of any disease in medicine or surgery about iodine and technetium. Right? So from there you need to explain. But that I'm telling because I feel like it's a very new thing, because even in the textbook there's not a lot of information for undergraduates.
There's not a lot of information, and the beautiful part about nuclear medicine is there are not many books and as per se also to read it. It's like whatever you have to learn, it's from your work and from your seniors. You have to be good with them. See, again, if you have good rapport, only then you can learn. And how will you build this rapport? Through your MBBS interactions. Because this is such a branch that there's no online course where you can sit down, watch YouTube videos. There's nothing. Even still I'm exploring. Still I'm getting to know what this branch has to offer. I think it's a great branch. I could say it has been in existence, but it's a upcoming branch, great potential. The seats are limited currently. In Telangana, we have only 3 seats.
Only 3 seats in the state?
In Telangana, only NIMS, AIG and my institute offers. Each institute has 1 seat. And in overall India, if I'm not wrong, we have around 35-40 seats. Like per year, those are the admissions you get. So it's a limited branch, and wherever there's a seat, there are only hardly 1 or 2 seats.
So you are very content with your job because it has the therapeutic.
Yeah, it has.
So that is like the last care of treatment, right? So when everything else is failing. So
there's therapeutic part. I am content with the treatment. The other day itself was, we treated someone. The cancer got completely updated, and they got us a box of sweet, like to the entire department. I mean, what?
That is what you expect.
Yeah, we look forward to, we don't expect, but we feel happy when someone comes back and they're distributing sweets, because cancer is such a stigma or such a big burden where you hear that news, it disrupts the peace of your entire family. And when something like that happens and you're finally cured, the happiness with them is just crazy.
And the money can't.
You can't buy that. That thing where they come back happy. So I think great,
content with your job.
I'm totally
job
content.
satisfaction.
Yeah, I was little reluctant. I was like thinking, where am I? But I did spend a good amount of time. I explored about this branch for 3-4 months. Spoke to many residents, whomever I could find online. Because these days it's easier to find anyone. So I looked up to them. I spoke to them, then I was like, okay, this is something which would suit me. There's good work-life balance, and the pay is also good. The pay is great so far. The pay is good. There's good work-life balance. There, obviously every branch has a few cons and all. There's not full clinical interaction. There's no, there's not much surgical skills involved. If you want to become Arjun Reddy type of vibes, blood postcode and all that. There's nothing like that. But if you want to have a good work-life balance, you want to also have some clinical interaction with some decent and great money as well, then this is a perfect place to be.
Okay, sir. And the cursed question which nobody wants to answer, the NEET PG preparation phase and everything.
Okay.
How should we go about it? Like not just me in general MBBS students or
MBBS students.
intern.
I believe the ideal time would be 3rd, 4th year. You start slow. It's not that you complete all the videos and all. The ideal time is 3rd, 4th year, which as everyone says. But thing is, mostly it doesn't happen. For me also, I never actually during my 4 years, I've never ever taken any this online platform or anything. During internship, I took a platform. I shared it with my friend. Then it started, and during internship also, due to the hectic duties, due to enjoying life because you're getting money for the first time, I never happened to study. Then after internship, obviously we sit for 6 months, 8 months or 1 year, we slog, and it is doable. If someone is starting from the scratch, you have not done anything, you're in your post-internship or during internship, I think there's nothing to regret. Just tell yourself you're going to slog for 6 to 8 months and you'll be good to go. Pick any coaching, people will be like comparing, Marrow, that, this. Everyone is the same boss, I always tell myself, who are we to compare, Every platform,
Teachers
they have completed the MD, MS, they're such high qualified people.
20, 30 years.
15, 20 years, 20, 30 years experience they have, and they're comparing them. Just pick whatever, you feel is right, pick a platform, just go about it, have the confidence you can do it. There are many people who just lack the confidence. They're like, we can't do it, and just aim for the highest thing, hustle, and I think they'll be good to go. 6 to 8 months of solid preparation wherever you stand. Obviously, if you are starting early, it's better. You can slog less and get it done in a longer period of time. But if you have limited time, this slog.
Because people are trying to cram up stuff from first year. People ask me, how should I prepare NEET PG notes from first year of MBBS?
I'm like, why go enjoy boss? That is the most, I think, useless thing to do. Just don't do. I think, you want to watch.
Just a logical answer. I was thinking in my brain, okay, you're making notes, handwritten notes in your first year. You expect to keep them for the next 5 years?
5 years. Like, you're not going to update them, you just don't keep them.
It doesn't work like that.
It doesn't work like that because, there are 19 subjects there. And at first it doesn't fall in place. When you study anatomy, physiology for the first time, like, what is all this? But when you get to the 4th year, there's a connection. When all those dots start to get
the dots backward,
then you'll be like, oh, acha, this is why we studied this. So those connections happen way too later. So I think at that time, 3rd, 4th year, even 3rd year is also like 4th year also, if you're serious enough, and even internship you complete 5-6 subjects, then anyone should be good enough to get it done. Just stay consistent and never ever think that you cannot do it. There's so many people whom I know, they're like, they lack confidence. I've seen so many of good people, I think much more intelligent than me, much more slogging than me, couldn't crack it. I think the only reason being they were, they didn't plan things well, they didn't have the confidence, because it is all about confidence game. How you perform those 3 hours, irrespective of what you studied, how you perform those 3 hours will change the entire course of your career. So be serious, be consistent, and this is good enough to get it done.
Sir, and also a small insight about the part-time jobs that people do after MBBS. Not people do, I've heard you talk about it, so some light about that too.
I think, if someone, obviously, after we get our MBBS done and all, people have this thing where, for some, finances is a big role, because, so far we have only been dependent on our families. They're paying for everything and all. So they're good opportunities. The easiest and the coolest opportunity I feel is, I can just go to a medical college, join as a tutor. In your own college, they'll take you up when the posts come up, and the pay is good in our state, around 50, 55. It's a good pay. The working hours are flexible. You can even study. If not, there are many private, hospitals and all, where you get a decent enough pay, 30, 40K. If you have good skills, which obviously you acquire in your internship, there are hospitals they'll pay you up to 1 lakh as well.
Listen to this.
Yeah, they are hospitals, you know, we might have a notion. Yeah.
Because people have made, I've talked to this in other episodes also, that they have made MBBS feel worthless. I don't think it is worthless.
It is not worthless. It is all about skill, boss. See, no one, when you go to the market, you know, it's like, this is a market. Hospital, whatever, private, government, it's a market. They don't look at, you know, you're from Osmania, Gandhi, anything. They look at your skill set. If you have a good skill set, I'm telling you, the people who are earning, just MBBS doctors, 2-3 year passes, they're earning close to 1 lakh. And it is easy. There are opportunities. It's all about how we explore, you know, the more peripheral you go, you should be capable enough to, you know, manage a hospital alone, you know, from 9 to 5 p.m. They'll pay you 1.5 lakh, you know, with food and accommodation as well. And the entire amount is up to you. Obviously, in cities, the pay is low, that is there because, you know, the other people who are working, you know, people recruit all this, you know, other people, you know, all this pharmaceutical, be those BSc guys, you know, BAMS guys and all, you know, because of them pay is around 25-30. But if you have good skill set and you're willing to move a little far, you know, you can make good money. And there's also, for, you know, temporary time, I did a teleconsultation job where, you know, I was working 3-4 hours with Apollo and they were paying me close to 25,000, you know, 3-4 hours per day is easy, you know, like, you know, at that time you can prepare, you do anything. So I was working 3-4 hours, you know, getting 25k. 25k is decent enough for 3 hours. Okay?
Yes.
And it was work from home. I'm just sitting at my home, you know, looking at my laptop, working, sipping a coffee, looking at the patients. So it's a good life for the pay. Obviously, you want to earn more, you have to obviously put in the hours. But there are options. There's also option where, you know, one of my classmates has gone to this, you know, CMS, UPSC CMS thing. It's like a government post type, you know, you get good pay, you get good accommodation. That's also there.
So there are multiple options.
There are multiple options.
Because I feel like once you get into the thing of NEET PG, like people are losing their lives in it, right? They have taken it up so seriously. I'm like, you have done your MBBS properly, you can build a life around it. Still prepare for NEET PG, do your thing, but don't get disheartened, right?
Don't get disheartened. See, PG is just a, you know, another extra thing in your life. You get it, that's good. Obviously, you're upscaling yourself. If not, also you can survive. But I'm telling you, the differentiation comes on your skill set. You're not skilled enough. You can't diagnose a patient. You can't do the basic skills. Obviously, no one is
fitting
going
into
to
the
pay.
workplace.
Yeah, you have to fit. You have to have those skills, and you know, you have those skills. Anyone will acquire you. There are many foreign medical graduates as well. You know, they work in private hospitals and they take a 60-70k salary. You know, just even though they have not cleared MCI. This is actually illegal.
Okay.
There are people, but you know, they have worked in that hospital 2-3 hours. They've learned the skills and they're earning.
So it's a skill thing.
It's skills. So where do you learn skills? Obviously in your internships. You know, take your internship seriously. Prepare for your PG as well, but take it seriously. Learn those skills, and if your PG doesn't go as well, those skills will at least help you sustain yourself for the next.
And don't just keep one
years.
thing in your brain. Like explore all aspects of life.
Don't not just, you know, one branch and all. You know, explore, find out. And the good part I'll tell you about internship is you'll realize which branch to pick, which branch not to pick. For me, what I told myself before entering internship was like, I want to become a surgeon. You know, that was my mindset.
Okay.
But going through, you know, seeing surgeries, going through that process, it was like, this is something that is not going to
Not for me.
not for me, not going to suit me, because, you know, my priorities in life are different. So you'll get that clarity as well. You skip internship, you sit at home, you send someone to work for yourself. You know, there are people who do that. You know, they don't turn up to internship. They, you know, pay someone else comes and does the duty. At least you'll figure out what you don't want in life. You know, you'll be left with 4-5 options where, you know, you'll understand you're a surgical person, you're a medical person. That also you'll get some clarity, and then, you know, things will make better, because, you know, people don't realize how important it is to choose a PG branch. One of the sirs, I remember when during my coaching, he told that is like a big marriage. You know, it is more than marriage, because you are going to stay with that branch till the end of your life. 30-40 years, boss, till the day you die, that is what you're going to practice. So it is important which you choose. So what you choose is so important that it is determined by your experiences. You have no idea what to do, what branch has to offer to you. And how do you make
So
that?
you shouldn't be predetermined, sitting in a room, preparing about that brand, not even exploring that brand.
Even first year also you want to become a neurosurgeon directly through marrow. That is not going to happen.
Explore everything and add things to your...
There's so many things, you know. I was recently going, you know, people who are just done, you know, SPM and all, they can go to such big positions, you know, they can join World Health Organization and all as well. What more do you want, you know? You can
more people who are thinking out of the box. Genuinely, I felt like I was somebody who can take up preventive and social medicine, because I like communicating and organizing stuff. And there is so much stigma around certain branches. I'm like, you don't know enough.
Don't know. Yeah, maybe it is not good at your place, at your hospital, but there's so much to it. People are surviving. There's so much to it. People are having a healthy life. People who have taken biochemistry, pathology, they are way more happier than surgeons. You're slogging, hustling, or not even finding time for themselves or their families. You get a balanced life. Obviously, it is priority. If someone has that passion to go for it, obviously go for it.
But not just for the pay.
Not just
life has become like, I need to earn 50k per month, or 1 lakh per month, or 2 lakhs.
Just for the pay. Pay is what pay is again skill dependent. You have the skills, anyone will pay you. Because see, in market now they say radiology. Do all radiologists earn the same? No. You have to be a skilled radiologist. I always, when this radiology thing was going on, again I questioned myself as well. In the previous 4-5 years, I think the most elite minds, like the toppers, whatever, all those people are going to radiology. I'm like, how will you fight? How will you survive? It's like the top people you're fighting against themselves when you come out of that degree. How are you even going
to sustain? Whole life is going to be a competition.
It is going to be, because the most, nerds or the most elite people have joined, the top 1,000 ranks have joined into radiology. How are you going to compete?
Keep hustling for the rest of your life.
Because after that you're like, other people are so competitive, you have to read. So take a wise choice.
Okay, sir, wrapping it up, any piece of advice you want to give to the juniors?
Juniors, I think these generation juniors, I don't know what is wrong. I think because it's the social media influence and all, they are, I think, way too into all this, studying too much, or not interacting with people. I would say juniors, just go outside, interact with your seniors, at least interact with your own batchmates, get to know your friends, people from the same gender, opposite gender, whatever, but get to know people, make good friends. Even I have a great bunch of friends. The bond is still same, even though you are in MBBS, even they are whatever. Make good friends, explore life. MBBS is just a degree. This is not life, okay? There's much more to life. Don't make this, everything. There are way more things in life. Enjoy life, live your life. Don't limit yourself to studies. Explore, Abhinav is a great example where, explore social media, explore your passion, You have to explore. That is when you'll realize what you're good at. Everyone has that talent. People are like, I don't know what to do. Everyone is good at something. It's all about, realizing and just explore, enjoy life, and, stay happy. Don't take stress for anything, okay? NEET PG, anything. Never take stress, be confident, enjoy life, and, good things will definitely come your way.
Thank you, sir. Thank you for this wonderful opportunity.
Yeah, thank you for this opportunity, Feeling special to get, some,
us filming in the hospital is also a very special moment for us. Thank you, guys. Thank you so much for watching.
Yeah, all the best.